Welcome back to my channel. You need to listen to this. It might be for you, it might be for a friend, a family, or someone around you. So many people suffer from a mental health condition called bipolar without them being aware of it. Bipolar is a mental health condition whereby an individual experiences swing in moods. The person has two different moods. It can be at the same time, it can be within a short interval. People with bipolar sometimes experience low moods. That low mood is called depression. When they are in that stage, they feel sad unnecessarily. The person feel hopeless. The person lost interest in what she or her loved to do. At that stage, the person is easily distracted. The person will lack sense of judgment, and there's always a thought of suicide. And when the person is extremely happy, which is called hypomania, the person tends to, make some decisions without good sense of judgment. Even though that stage is likely to be harmless, but when the person is in the other moods, which is our major concern, that is the depression, it can affect that individual negatively. And the thing is, bipolar does not go in on its own. It requires the individual to take an action. Sometimes you'll be wondering why someone around you is behaving the way he is behaving. And most people with bipolar are not even aware of what they are doing, especially when they are at the crisis. They are not aware. They just feel like they are doing normal thing. But actually, to people around them, it might not be normal. So that's why people with bipolar mostly have relationship issues. Relationship with workers, with people around them, and with their family members, because they tend to hurt people's feelings when they are in their depressive stage. And 6% of people with bipolar ended up committing suicide, while 30 to 40% end up harming themselves in a negative way, especially when they make wrong decisions that they have to live with it for the rest of their lives. There are some risk factors that can actually expose an individual to bipolar. When we say risk factor, we are looking at those things or those situations that can contribute to the occurrence of this mental health condition. We have environmental factors, things happening around an individual, such as stress. When you are stressed for a long period of time, you might likely develop bipolar. We also have factors like family history or genetic traits. If you have family history of mental health condition or depression or any of the mental health conditions, you might likely develop bipolar. Bipolar does not kill an individual, but rather it can make an individual to harm him or herself. So how do we prevent this disease? This mental condition can be prevented when an individual identified and recognized that he or she is suffering from this condition. That is the first step to prevent this disease, to treat this disease, to manage the individual that is suffering from this disease. So once you identify what you are suffering from there you'll be able to seek counseling. And when it is extreme, you might need some medications that will help you to control the depressive moods. Remember, we are our brother's keepers. When you get the information, ensure that you share it to others. And when you see anyone suffering from this condition, you need to help that person before it becomes too late. Mental health condition is one aspect of health that sometimes is being neglected, especially in developing countries. So we need to take our mental health serious, because it can also affect our general well-being. Keep listening to our channel, and we will be bringing you more updates on public health and how you can stay healthy in your society. Have a great day.